All right, so people get sick, and then the drug companies go into research mode to figure out what they can do to help people get better. So they develop a drug. The doctor diagnoses you with a problem. He prescribes this drug. You go to the pharmacy. They fill it. They give you the instructions. And all of that can go, you know where. It goes down the drain if you don't take your medicine on time and exactly as prescribed. It's very important in terms of managing your health. Dr. B joins us now, our friend, Dr. Brent Wallis from People's Health, to talk about medication adherence. Good morning, Dr. B. How are you?
Hey, Tommy. I'm doing great. How about you?
I'm ready for the Saints to get it going against the Falcons on Sunday.
No, me too.
Tell me what medication adherence is.
Sure. Medication adherence is really two different things. It's taking your medicines the way that we prescribe them, the way your doctor prescribes them, but then also taking them for as long as we prescribe them. So, you really need to make sure you're taking the correct dosage, as written on your bottle and the way that we intended for you to, and not cutting your pills in half or doubling up your doses. Some people do that sometimes, and that can be dangerous. The other thing I mentioned is taking it for as long as we prescribe it, and what that really means is don't stop your medications early. Chronic medications need to be taken chronically for a very long period of time, and so if you don't think you need the medicine anymore, you really need to talk to your doctor before you stop it, because stopping it can cause a lot of problems.
What happens if you don't take your medication as it's prescribed?
Yeah, this is a really big problem, and there's been a lot of studies that have been done to look at how good people are at medication adherence or taking their medicines. And unfortunately, it looks like about 20 to 30% of prescriptions are never even filled. So they may be sent into the pharmacy and nobody picks them up, or they're written by a doctor and no one ever gets them filled. And about half of all medications for chronic conditions, things like diabetes and heart disease, are not taken the way that they're prescribed. And, that can really have a lot of serious consequences. Whenever you change your medication routine, like I was saying, either stopping it or changing the way you take it, that can cause a lot of problems. And so that can lead to treatment failures or really worsening of those chronic diseases. And ultimately, what we worry about is that could result in you ending up in the hospital. So it's really important to listen to your doctor when it comes to your medications.
If somebody were to say some of the following statements to you as a doctor, how would you respond? For example, or say I would tell you, Dr. B, I feel fine. I don't need to take my medicine.
Yeah, I hear that one all the time. And actually, it is true, but the thing is you probably feel fine because you're taking your medication. It usually means the medicine is working, so you want to continue taking it.
Guilty as charged on that one. How about if I'd say, I don't like to take my medication because of the side effects. I don't like the way it makes me feel.
Yeah, this is another problem. A lot of medicines can have certain side effects in certain people, and they vary from person to person. So if you think you are experiencing a side effect from your medication, especially if a new one has been started, talk to us. Talk to your doctor. We have a lot of tools in our chest, and so sometimes we can adjust the dosage on the medication. Sometimes we can actually prescribe a different medication that may not have those side effects, but is equally effective for the condition that we're trying to treat.
All right, Doc, I know you prescribed the right medicine to me. I know I need to take it, but here's the problem. I can't afford to fill them. I can't afford to get them filled. What happens?
Yeah, drugs are expensive often, and so that is something that you need to talk to your doctor about as well. We try to be conscious of what the costs are, but they change, and different insurance plans have different coverage and stuff. So, one of the things I tell my patients is that a lot of times there are generic versions of brand name drugs, and usually brand name is going to cost more. But generic drugs can be just as good. It's usually the exact same active ingredient that's in there. So if there is a generic alternative, that may be a lot cheaper for you. And then the other thing to keep in mind, some people don't know, if you're Medicare eligible, Medicare has something called the Extra Help Program. And that program is actually a program designed to help with your out-of-pocket drug cost. And that can include your co-pays or co-insurance for any type of prescription drug. So you should contact the Social Security office or call your health plan to talk to them about that extra help.
What about, do people really, and I know I've heard stories about this, they think the pill looks different or the tablet or medication, whatever, it's different, so they think they can alter the way they take it?
Yeah, you do have to kind of be on the lookout because pills can change shape, they can change color. Usually generic versions of a brand name medicine may have a different look to them. And so, a couple of things you want to do. If you all of a sudden get a pill that looks different than what you were taking, you want to talk to your pharmacist first and say, did you switch my pill by accident? Is this the correct medication? They can actually look it up and they can tell you very specifically, no, we filled the right thing, but hey, we had to switch manufacturers. And this happens all the time. There's usually a couple of manufacturers that make the exact same medicine, but they look different. And so, don't be afraid to ask your pharmacist, is this really what I'm supposed to be taking? Your doctor can sometimes help you as well. There's an app for that we can use on our phone to scan it, but the pharmacist really knows what they're dispensing, so make sure you talk to them about that.
All right, let me take a break. When we come back, we'll talk about some tips for sticking with your medication plan because it all falls apart if you don't take the medicine as it's prescribed and as the doctor tells you to, and you don't take all of it. And again, I'm guilty of it where, well, why'd you stop taking it? Because I was feeling better. Yeah, that's because you were taking the medicine, dummy. Taking your medications on time and exactly as prescribed. It's important. Dr. Brent Wallis from People's Health is going to come back in a couple of minutes to talk about maybe a way to stick to your medication plan. Right now, time for traffic on WWL. 8:26 and a half, Tommy Tucker, WWL. Quickly back to Dr. Brent Wallis, Dr. B, Chief Medical Officer with People's Health, as we talk about taking your medication on time and exactly as prescribed. A text comes in from Karen, Doc, that is nice. Says, happy Thursday. I look at taking medicine like a boxing match. Your opponent may be knocked down, but knocked out until the medicine is gone, and I guess that's a good way to look at it.
That's a great way to look at it. Make sure you finish that bottle.
What are some of the tips that people can adapt for sticking with a medication plan?
Yeah, there are a few things you can do. It can be real tough to remember sometimes, so you want to try to create a routine so that you do the same thing every day. So if you're supposed to take your pills once a day with food, try to put them near where you prepare your breakfast for the morning, or if it's at nighttime, you may want to put them near your toothbrush or on your bedside table so that you remember to take the pill when you need to. If you've got a lot of pills, which unfortunately a lot of people do take a lot of different medications, invest in a pill box. Pill boxes are great. They've got a lot of different types with compartments for every day of the week, even multiple times a day. You can fill that up and actually make sure that you're taking something, because if you look in the little window and there's still pills in there, you missed it. And then you may have to set a reminder for you to go to your pill box and take your medicines. And everybody's got a cell phone, so you can set alarms on your cell phone that recur, and when they go off, you need to go take your pills. They even make pill boxes that have alarm systems in them. So, the other thing is make sure you don't run out of your medicines. I see this a lot. People get towards the end of their bottle, or if they're filling up a pill box, they don't realize they don't have enough left, and this is really critical, during hurricane season. We've talked about that before. So when you're filling your box, make sure that you've got a full week available. If you don't, you want to call in a refill, or talk to your pharmacy. All pharmacies, for the most part, have automatic refill programs where they'll notify you when they think you should be out of pills. And that's also a good reminder, because if you're not out of pills, it means you probably haven't been taking them the way that you should. And, one other thing to kind of keep in mind is some places you can do mail order as well, and that kind of takes the guesswork out of it. They automatically mail you medications for a 90-day supply. And the last thing I'll say, 90-day supply is really important, because it's hard to remember to fill your meds every single month. So if you do them in 3-month increments, you only have to do it 4 times a year.
What if you're worried about taking your medication correctly?
Yeah, especially if you're taking a lot of medications, you can have trouble managing those, and so you definitely want to talk to your doctor about that. What happens a lot of times, pills are added. Sometimes you go to another doctor or multiple doctors, and they're, adding new medications and not necessarily looking at the overall impact to the patient. So you want to talk with your primary care physician and say, here's everything I'm taking. How can you simplify this for me? And, we call that a medication reconciliation, where we're really looking at what you're taking and making sure you still need to be on it, stopping what we can. Sometimes, though, we can simplify your treatment. We can combine medications. We can actually change the time of day you take them so you're taking pills less frequently. So, again, always talk to us about that if you're having trouble taking your medicines correctly.
I'm no computer whiz, but I think all of us can open a Word document, so I keep a list of it on a Word document and then edit it, and then when you go to the doctor, just print it out, and there you have it. Thank you, Dr. B.
Thanks, Tommy.
You have a great week.
Weekend.
Go Saints. All right. Now, if you want to find out more about People's Health, you can go to peopleshealth.com. You can call 1-800-978-9765. And, of course, you can always visit the People's Health Medicare Center. That's 3017 Vets in Metairie. Appointments are recommended, but walk-ins are welcome. And you can always follow People's Health on Facebook, Twitter, and Instagram. peopleshealth.com. It's 8:31, a minute late, time for WWL First News, and for that, we go to Ian Ozan.